do is bring in the youth to the table to hear their concerns. I think we need to create a safe space within the school system. So those are my two main things. It's all about communication and bringing those individuals to the table to hear their concerns instead of us always trying to figure things out, having an open dialogue.
Thank you.
I'm in the community and I'm around this stuff every day, and I would like to speak up and give y'all an idea for the children.
I'm sorry, at this time, we're just getting leadership input, but we will have opportunity at the ending for that. Okay? Thank you so much.
I'm sorry, I didn't know.
That's okay.
So, Madam Chair, I'm sorry. You know, as we shape the discussion, and this is just kind of piggybacking off of previous comments from the chairman and from my colleague, there are a number of things that, as the governing board, you know, our main responsibility is policy and budget. And as we set the tone of policy and combine the resources of budget between the city and the county and the school board, I think it would be helpful to figure out strategically what our goals are, our outcomes, which you're highlighting now, and to see what it is we're already doing so that it's not a duplication. I do think, as the young lady said, that the grassroots and partnerships for some of the people who are in the execution part of the scenario will be helpful. But from a policy, budget, strategic planning, we're about to go into strategic planning in a week or so. I think you all are in the school board. Just want to tap and see what the appetite is for some alignment with some of these common ground areas. If we're talking about behavioral health, you know, I know the county's kind of looking at that holistically. You know, that way we can share some of the spaces that we're in. School board maybe can talk about their aspect with the kids and kind of put the conversation together. So I just want to make sure that all of our discussions are kind of strategically aligned on our goals. So.
Thank you for that input, and as a vice chairwoman, I'm glad that you mentioned that. That was next on my list because just for a lot of you all to know, the city and county does work together in recreation. So where I'm going at with that is that, and then I'm going to get to Dr. Conley. We work together in recreation, and so I'm glad that some of the words I've heard is youth, coordinating, which would also consist of what we could put on the board, more teen halls, because I do feel like there's a generational gap. Thank you, Councilwoman, when you stated in regards to making sure that we have the voices at the table. I think that some of the things that we could look forward to since the budget is coming up. I know that you do have a city council, youth council, maybe getting some of their input in regards to some of these matters. I know one of the things that I'm hearing from the youth in itself, speaking of budget, is maybe looking into getting the hours of the recreation center expanded. Because again, if our children don't have places to go, then that leads into other issues and problems when it comes to their health and wellness. So in regards to that, objectives, you're right, things that we work together, city and county very well. Through the years, we've had an expansion of our recreation, but looking at services at the recreation, and one of those objective positive things could be possibility extending the hours of some of those recreation centers. And then also, I know there's things in the school system, so I would love to hear your input because again, our budget from the county, we provide that for those that may or may not know to the school board, and youth is our next generation. Dr. Conley, if we could have some of your input, please.
Thank you, Madam Vice Chairwoman. In the school system, we have implemented the Alongside app. It's an online digital app that children can access on their phone. And there's a llama that they interact with middle school and high school students. We have found a high level of utilization by our students with that app. We also implemented calming corners where students have a place to go to calm down. We continue to partner with Dr. Green, Ms. Jackson, and their staff to provide mental health support to students. And obviously we need more social workers in our school system and counselors. And even the pipeline availability of people to hire we got to improve that with the universities as well. But I would say we're very grateful for the collaboration that happened between our staff and Dr. Green and her staff and Ms. Jackson and their staff. But we do need more referral for higher level support when children are presenting with significant mental health challenges. I ought to know, but I don't know. But I don't think Cumberland has a residential facility for children for mental health needs.
Thank you so much for that input. And at this time, I'm going to switch some things up here on our agenda because I think this would be a good place for Dr. Green and our guest speaker to just piggyback off what you were saying, Dr. Conley. We do have with us today our executive director, which is Ms. Dr. Green, as well as Leah Rhyme. She is a health educator, and since that seems like everyone's in consensus of collaboration, speaking of the importance of the youth, and I want to thank you for mentioning those apps due to the fact that when I speak of generational gaps, it's important that we can speak to our youth on the level of, how we can relate and how we can communicate with them. And we know that social media and apps is very next generation. So we are going to move things around a little bit here. I think that this will collaborate and connect very well. It states on the agenda number 7, but this will be a good time. Dr. Green and also Ms. Leah Rhyme, a health educator. They are here today to present. Some of you have small cards here. Since we are on the topic of youth, it says 988 Suicide and Crises Line, which does definitely tie into that of emotional wellness. Dr. Green, I will turn this over to you at this time.
And Madam Vice Chair, before you move, I know my chairwoman has anything she wanted to add. Okay, all right.
I'm sorry about that. Okay.
Good afternoon, everyone. My name is Jennifer Green. I think I know lots of you all in the room, but we're glad to be here today. Leah Rome is our health educator with the Public Health Department, and she's going to do just a brief presentation in just a moment. But I wanted to just cue her up and talk just a couple of the things that Vice Chairman woman asked about. So we just did our community health assessment. We do this every year, every 3 to 5 years in collaboration with the hospital, and we just completed the data collection part of the community health assessment in 2024. We did community surveys. I think we had over 1,200 community surveys. We did several community listening sessions, some stakeholder input, and that resulted in several community priorities. So I just wanted to hit on those really quickly and tell you what those are. And it aligned with all the things that you all are talking about today. So maternal and child health is a priority, physical health, which would include chronic disease prevention, and then the last one that aligns with this conversation is about behavioral health and substance use and mental health. So those are the priorities that we're going to be looking at, and what happens after we do our community health assessment. We're finishing the report, and actually I think the report is on my desk for final edits, so I'm the hold up here. So those final edits will be released, and then we will put that final report on our website by hopefully by the end of February. It'll go back up to the state. And then the next steps are for us to make those action plans. It's certainly in alignment with what the city is doing, what the county is doing, what our elected officials want to see. But that's community work. That's, of course, not just the health department, but across the county. What are the things that we can coordinate and collaborate on so that we can move those health priorities? That doesn't mean other priorities are not important. The health department has a strategic plan that touches on some of those other things that you all mentioned and some of those other dimensions of wellness, but those are the priorities that we're going to be looking at over the next several years. So on your tables, we have, many of you all are familiar with the 988 hotline. That's the national hotline that SAMHSA has and we implement locally to work on mental health. It's our crisis and suicide prevention line, so you all know 911, we call that in the state of an emergency. We want to call 988 if there is a mental health emergency. And so you all have that in, hopefully maybe a little card. If not, we'll get you one. We brought that today, so as a reminder for you all, if you need those 988 resources in your departments and as you go out and do work, we can help get those for you all. We collaborate, of course, frequently with Alliance on mental health. So we're not the mental health provider, but we certainly help to support the school system and then all of the other agencies across the county on how can we help coordinate services along with our partners at Alliance. So we have a little 988 video for you all, and then we will, we'll have Leah Rome come up and do just a brief.
988 is the number that can make a difference.
It's the number to use when you need help and you don't know where to turn.
Call, text, or chat 988 day or night.
The number where someone will always be there to talk.
988, the National Suicide and Crisis Lifeline. Learn it, know it, share it.
Because you never know when you or someone you know might need it.
Talk with someone who cares and get to a better place. Call, text, or chat 988 24/7. 988. Let's get through it together.
So hopefully you all have seen and heard the 988 hotline. We want you all to be familiar with that. Again, if we can at the health department help you get those resources in your hands, let us know, and we can help facilitate some of that conversation. And Leah, if you would like to come up, she's going to share just a few things about self-care. Commissioner Jones asked us to share just some things about self-care as we get ready for this new year. You all have a big year in front of you. Y'all are each doing your own strategic planning, and so she wanted us to sort of set the stage for you all as you all are doing your own work. How can you practice a little bit of self-care and wellness as well? So if I can figure out how to make the screen, there we go. So she'll be here for you just for a few moments, and then we will, if there's any questions, I'll be happy to do that.
All right. Good afternoon, you guys. Again, my name is Leah Rome. I'm a public health educator at the health department who specializes in mental health. So this PowerPoint is basically going to be a brief PowerPoint regarding self-care and...
I'm sorry, Leah, can you speak up just a little?
Yes, ma'am.
Thank you so much.
So this PowerPoint is going to be a brief PowerPoint regarding self-care strategies for your leaderships, roles that you guys are in the community doing. So the importance of self-care is basically that self-care is not an indulgence. It is about maintaining the foundation of your well-being. A lot of times people think that self-care is just a quick act that needs to be done within a quarter amount of minutes and be done with, and that is it. It's all about, self-care is not just about you, it is about your team, and it is about the community that you guys serve. It is a rippling effect when it comes to self-care that not a lot of people realize, especially people in leadership. They think it's just an internal concept and not an external concept. So when it comes to having challenges regarding balancing responsibilities, it is important that we acknowledge the challenges first. A lot of times in leadership, we try to bury down the challenges until we get to it later. But I just want to bring up the importance that facing the challenge head on is probably going to be your best goal when it comes to balancing out responsibilities, because when you're facing the challenge first, you're balancing out many roles, often feeling overwhelmed and not being able to have the correct headspace when facing those challenges. And some practical self-care tools can be setting boundaries, prioritizing health, and maybe embracing some micro self-care strategies. So when it comes to boundaries, you can be setting curfews. I know with my WebEx, I have a curfew that after 5 p.m., you cannot reach me through WebEx. And I'll see it in the morning. When it comes to prioritizing health strategies, I know at the county we have a program called HOPE. I don't know what the city has, but that is a great thing that if you're not already prioritizing the HOPE strategy, to utilize it. And if your organization does not have a HOPE strategy, maybe incorporating a 10-minute walk, or maybe if you could have a walking meeting. Oftentimes with leadership, you guys are in a, not necessarily a cubicle or a box, but you guys are always computer facing. So if you guys can probably do a walking meeting if possible, that would be really great. Or even journaling your meetings down and journaling your ideas where you guys can come back to it later will be a great strategy. And then when it comes to micromanaging and micro self-care strategies, taking a 5-minute break to breathe, to stretch, even if that's a 5-minute computer screen break where you're like, okay, I'm gonna step away from my computer for 5 minutes and then come back to it. A lot of times those small results yield great meanings and great impactful productivity. A lot of times we don't see that. A lot of times we're like, oh, it's so small, it's so constant, we're not really going to pay attention to it. I'm here to say that you actually will. Studies have shown that small steps, great rewards come to it. And when it comes to work-life strategies and balances, I know that's a lot of big thinking when it comes to that as leaderships, because all of you guys have great and powerful roles in our community. But at the end of the day, if you're not taking care of yourself, how can you pour into the cup of our community members? So maybe having strategies as time blocking, delegating time. I know delegation when it comes to leadership is like a scary word that you guys try to shun from. But delegating is not a sign of weakness or failure. It is a sign of you basically taking yourself first and prioritizing yourself. Because again, if you can't pour from an empty cup, how can you pour to our community members, right? So staying flexible, again, that is going to be a tough subject at first, because again, we all don't know what our capabilities are until we're thrown into that moment. But staying flexible, being able to leverage at any moment is great. And then going into leverage, having support systems. A lot of times we don't have support systems that we thought we had in that moment until we're in a moment of crisis. So basically, if it's okay for you to lever and build a trusted circle at home and at work. So those are just some strategies that you guys can incorporate in your life when it comes to work-life balances. And then I suggest when it comes to work-life balances, if you guys never heard of the app called Asana, it is a great app and a great tool for time management. I was recently introduced to it and it's wonderful. Chef's kiss. When it comes to mental health and emotional well-being, we all know that sometimes when we think about mental health and well-being, we think about the negative aspects of it. Again, that what Ms. Jennifer had mentioned, what Dr. Green mentioned, when it came to 988. 988 is not a hotline that you could just call when you're in crisis. You can call any time that you need to talk to somebody. So if that trusted support system is not available, please pick up the phone and call 988. You guys have handouts in front of you, and if you guys need any more handouts, the health department definitely can supply you some with posters and palm cards and everything like that. But practice mental health strategies and mindfulness. So when it comes to that, you can do box breathing strategies. You can just be basically, again, time management. Having time blocks is a great practice tool when it comes to mindfulness and reducing your mental health. And then check in regularly, whether that is you're just checking with yourself or checking in with your support group to see if you guys are on a good playing field. And then seek help when needed. Again, therapy in 988 is not a strategy to shun you away from mental health and expressing your health, but it is a strategy to boost the morale, whether in your team and your community. Because again, having your mental health, it affects you and it affects your community whether you realize it or not. Because oftentimes your peers see your mental health drain before you even see it. So seeking help is a great tool. And then your role as leaders, right? So your self-care is going to be very pivotal, right? So when it comes to your role as leaders, is your well-being sets the tone of your teams and your communities. I have been preaching that since the beginning of this PowerPoint, and I'm going to keep echoing it because it's important for you guys to know that. Lead by example. So that is basically with the school systems and within county hosting mental health wellness events or activities that gets everybody involved, not just leadership teams, but everybody. That way you're showing that you're prioritizing not only your self-help and your self-care, but everybody that is that you're coming in contact with. And then create policies that support mental health and work-life balances. And then a call to action, right? So taking care of yourself is not it's not selfish, right? It's a necessity to stay alive. It is that quote saying is your self-care is not a luxury, it is a necessity, and it is. Oftentimes, again, we can't pour from an empty cup. How can I give to you if you can't give to me, and vice versa. So always take that into action when it comes to mental health, and this is a great call to action moving forward for the next 12 months for you guys when you guys are talking about overall health, especially when it comes to all the 8 dimensions of wellness. And that is my presentation.
Thank you so much. We appreciate you, Leah, and we appreciate your work that you do here in the community. And I'm glad that you stated about call to action, of which we all do have a big job to do for call to action and policies. And I have one thing that we have to announce, an important announcement from our county manager at this time, please.
Yes, due to an accident over at DSS and Public Health Building, we will have to close the building today. They have an estimated repair time of 3 hours. And with public health, we have medicines and things like that that can go bad in that time period if we don't have power. So both DSS and public health will close at 1:30 today. Thank you.
Okay, we now may resume. Mayor Pro Tem Kathy Jensen.
Is this how it turns? Oh, it's already on. Okay. Thank you, Chairwoman Jones. I do have a question for the 988. Yes. So when you pick up the phone and you call 988 and let's say you have somebody that is suicidal or they are suicidal and everybody around them, there's a threat, who comes?
So who answers the call or who can come to that individual person?
So my question is, somebody calls and says, I'm ready to kill myself and I have my family here. What are the next steps?
Yes, so that it depends on, they're not the police, and so it's not local law enforcement that answers the phone. It is typically a trained counselor, or in North Carolina, we have also a peer support specialist. So depending on the level of need, it will be the trained counselor or be a peer support specialist. If it's a medical emergency, so if they're saying there's going to be an active suicide or suicide attempt, then they will call like a local medical professional to come assist in person. But if it is, I'm having suicidal ideations, then they might, that counselor, that trained professional is going to talk with them on the phone. But they'll help to dispatch local professionals to assist. That's different than our mobile crisis, though.
Okay, so I have a teenager, and my teenager is up in his room threatening to commit suicide. I call 988. 988 will get to the phone and try to calm him down with the mental health counselor, is what I'm understanding. Correct?
It may also be local law enforcement or local medical entity, so like the community paramedics. It depends on what that person is saying, right? So if you are having a medical emergency, that requires immediate action beyond just we're going to talk about it. Or if they say, I have a weapon in my hand, that's going to be a different response than somebody that says.
That would be law enforcement.
That might be, depending on what the situation is. And that's what those counselors are also trained to assess. So if you are threatening to kill yourself or others, that's going to be a different response than I've had these thoughts or I've had these ideas.
So I guess my question is, because we are the policymakers here, right, and we are the ones that, my question is, I have a teenager, they have gotten a gun, they might have even made a ghost gun, correct, Councilmember Banks McLaughlin, that they can get off the internet. And they have this gun and they're saying, I'm gonna commit suicide. You call 988, as a parent, I've never had to deal with anything like this, but I'm hearing 988, 988. I call 988, they say, there's a gun involved. So does that go, the services that we have in our county, does that go straight to law enforcement? So
what I would anticipate is somebody has a weapon, I would say that needs to be law enforcement because there's a weapon involved. And what I'd anticipate is that 988 would say the same thing, is that there is a weapon involved, a lethal weapon involved, and so we need to get, in addition to trained professional counselors, you might need law enforcement involvement as well.
Okay, so 988 is what I hear is basically, and I'm just trying to get it in my head, because if we say, you have something going on, call 988, but if 988 is more or less that you have a child or an older, somebody in your family that says, I just want to kill myself and I'm going to overdose. And I didn't mean it to sound the way that came out, but it doesn't have a weapon involved, it might have drugs involved, that 988 is where you basically call and you get a mental health counselor.
Yeah, they're gonna help to triage some of that. So they're going to That's why we tell people to call 988, and they'll help to do some of that triage of, is this an immediate action? Are you just thinking about it? Or are you calling for somebody else? They're going to help that person get into the right entity. So that's part of their role.
What is that right entity?
It may be law enforcement. It might be we're going to call a paramedic to come. Or call emergency medical services. We're going to call EMS to come to your house. That's going to, I think, a little bit depend on what the scenario is, and they're going to do a little bit of that directing the traffic of where they're supposed to go.
Okay, so they're just directing for the services that are in our region.
They are familiar with their local resources, so they're trained to be familiar. And then, like I said, in North Carolina, we have, if you also call 988, we have a peer warm line. That is somebody else that's had some. Go ahead.
What I would like to see, and I will stop because we could probably talk about this for hours. What I would like to see is a list of those services that when you call 988, what are our services in Cumberland County and our region that we have to rectify, not rectify, but to have for the people that are in the house or the person that is trying to commit suicide. Where does it go from there? Where does the 988 call go from there? And I'm finished, and thank you. Thank you.
Yes, I'm trying to think of the list off the top of my head. They have, so Communicare does some mobile crisis, and we've done some community mapping with Crisis Collaborative and Alliance Health to get an assessment of what those community resources are. I don't have a copy of that in front of me, but there has been an assessment done led by Alliance of what are our community mental health resources available here. And so we can get that. I just don't have it in front of me.
Just a schematic of, you call 988, what happens next, what happens, that you have, if it's this, it goes here, if it's this, it goes there. And I think we can get that together and realize where we are. Thank you.
Yes, Mayor Mitch Coleman.
Thank you. And thank you, Dr. Green, for that. I want to kind of take Mayor Pro Tem's comments a little further. Okay. One of the decisions that the city council made, and we both can look at incidents that didn't turn out well, that when the 911 call was made, because you embedded people to call 911 when, according to this, some calls should have maybe went to 988. But in the event that law enforcement shows up, sometimes the outcome is not a good outcome. As we stand up our co-response and as we stand up Office of Community Safety, and this will be more of a detailed discussion with the county, we need to bring all of our knowledge and resources and connections to the table, because I'm with her. You call 988 for someone that's off-site or out of town, they dispatch it to a local what? And then after the law enforcement shows up, where do they go from there? Do they go to the hospital? Do they go to jail? Or do they leave? And then what's the follow-up for someone who was having a meltdown or a struggle, by these agencies? And so those are the kind of things that, just as we look at this whole circle, where are the gaps? So that assessment that you talked about, does it point to the gaps, or does it just say I have 10 partner agencies that are here?
Both and then I'll also note that one of the things we're doing at the health department is some sequential intercept mapping. So that is a little bit on what you touched on about the interaction between the behavioral health system and our criminal justice system. So actually on Thursday, we're going to be doing some sequential intercept mapping with our community partners. We have probably some of you in the room are coming on Thursday to the health department, and we'll be mapping out what does that look like. So for somebody that has a behavioral health crisis, we often know that they might interact with our jails or our prisons or our hospital system, and how do those systems interact? And then what are the gaps in services? And then we have a grant to do some building out of some of those systems, and how do those entities coordinate together so that there is some seamless referral sources and getting people connected to the right resources. So, and then the assessment that Alliance Health did, there it does do not just saying what we have, but there is some gaps analysis in that too. So I will get that to Ms. Tebby, and then she can send that out to the group if that's okay. And then once we have finished out our sequential intercept mapping, we will, we're doing it on Thursday, and then we'll share that back out with everybody. And again, the intent is to take what those gaps and opportunities are, and then to start kind of building up the system, and then, of course, putting that back in front of you all as well.
Thank you so much. And I just want to inform some people, for those that may or may not know the educational history behind 988. Originally, the 988, that actually used to be the suicide prevention line that you could reach by a 10-digit. And the fundings from that, it changed over to be 988, actually July 16th, 2022. And the fundings from that actually comes from, as we've seen the video earlier, the SAMHSA, which is the Substance Abuse and Mental Health Services. So it is funded through the government. So this is not just a local, when we talk about 988, this is something, so for fundings, and that's why the operationals behind the scenes, which we appreciate both the questions from the mayor and the pro tem, a lot of things that happen behind the scenes, as Dr. Green was stating, is not that of our control. This is a state funded, just want to let everyone know that. They do have more information if you go to samhsa.gov, of which the video we had earlier. And also, I think that is important that when we do have those concerns, of course, we work legislatively of all the different bodies together. So that's something, if we have concerns about mental health, which I know that myself and the chairman, we're pleased to announce, can't say too much, but we know the significance and importance of needing a mental health court that down the future we hope to have in place. It's not just about, very excellent points when someone makes a call, coming from being a mental health specialist myself, when someone makes a call, we want to make sure that if it's a call in reference to suicide, whether for adults or even for children, that it's handled appropriately, and not just handled appropriately though on the scene when someone comes on the scene, but that of retrospect when situations happen and individuals have to come to court. And so Cumberland County, we are hoping that in the near future that we will have a mental health court as we have for human trafficking and other things as well. Chairman Deviere.
Thank you, Madam Chairwoman. A couple things. One, the community mapping piece that the Alliance done, as well as the sequential, I think that's a great connection point, Assistant Manager, that we kind of alluded to, and how we're connecting the dots around the behavioral health component. So I think that's something that maybe once it's flushed out a little bit more, that I know a lot of us are going through strategic planning right now. It'd be a good opportunity to help us connect those dots. And I keep talking about capacity and connecting the dots. And just then on a bigger, that's on the behavioral health side. And then, Madam Chairwoman, if I can, Mayor, to your point, and just a general comment, as we go through these strategic plannings, my commitment, our commitment as a leadership team is to then also reach back to our partners, to the cities, municipalities, and the school board, our partner, to align our strategic plans and find the touch points in our strategic plans to make sure that we've got some actionable items from those strategic plans, not just in behavioral health, but in economic development and in public safety and all the core areas. So that's, to your point, Mayor, that's a piece that we want to look at in aligning those once we come out of strategic planning.
And we will send you all, Ms. Tebby, I'll send it to you. There was a sequential intercept mapping done in 2019, but we are updating it, and that one was just for adults. And so we are going to be creating one for youth and then one for adults as well. So it'll be two different sequential intercept maps.
And also, Dr. Green, can you inform everyone exactly where they can find the community assessment that was provided last year in 2024? I know it has a lot of great data information on there as well.
Yes, so so we do it again every 3 to 5 years. So the most recent published one is 2021, and then the summary of what will be the new report for 2024 is on our website at cumberlandcountync.gov on our Board of Health page, and we'll send that out to you all as well. So that one has a summary of it's not the full report, it's sort of a 2 to 3 page summary of what is going to come out in the full report. That one's on our website as well. That has a little bit of the data that the mayor was talking about, where we rank, what are the big health outcomes, and then it has the priorities that the stakeholders selected. So we'll send both of those to 2021 and then sort of the preliminary results from 2024 to both of you all, to all of you all.
City Councilwoman, I'd seen your hand lifted earlier. Courtney McLaughlin, please.
Thank you, Madam. Dr. Green, thank you for the presentation. As we talk about our strategic planning, this is city, county, school board. As we talk about our strategic planning, I think it'd be very beneficial to somehow, and I guess that's something dealing with IT, is ensuring that the resources from different entities is shared so it can be like a one-stop shop. Because a lot of times people are not familiar with the resources that the county has, that the city has, that the school board has, and we want to make it easy as possible. Because a few weeks ago, I called 911 because someone was thinking of committing suicide at one of the local restaurants here. And the first thing that I thought of, okay, 911, then I said and thought, well, if I call 911, will the police show up and arrest this person when they're just simply trying to get help? So to hear that information is great, but again, if I didn't know that, I'm sure it's other people in the community who's unaware of it. So I think, again, we should, as we talk about strategic planning, make sure we put some funds towards a way that, again, it can be like a one-stop shop so that those who are in need of whatever resources, they'll be able to get those services.
And if I can make a plug there, so a few years ago, our state health department, in recognition of sort of this challenge of resource finding, many people are familiar with United Way and the 210, and you can call 211 to get a community resource and figure out where to get routed. We also have NC Care 360. That is often times on the provider side. You don't know where to send clients to. You don't know where to direct people to. It is sort of a hub of these community resources. I can make a referral. Let's say I'm going to make a referral to social services, and then that social services person on the other side can make a follow-up, and then I, as the health department, will know, yes, that person got served, or no, they didn't get served, and I need to go find another resource for them, or maybe they weren't eligible. So it sort of closes that referral loop. Oftentimes, I say happens is we give out a pamphlet or a flyer and then we say good luck. This sort of closes that referral loop so I know what happens with that person on both sides, and then I can help get that person, sort of direct a little bit of traffic to make sure we know what where that person falls and make sure they actually got the service that they needed. So we're working on expanding that too in our community.
Thank you so much, Councilwoman. And also, speaking of resources, I'm pleased to announce, as the chairwoman of the ARP, and we have our chief of staff here, and he is developing a plan now. We do provide fundings for individuals that are nonprofits, and we're working on just basically re-implementing that plan. So we understand that it does take a village. There's nonprofits that provide services for mental health in our community. And so on the county front of things, and we do have our chief of staff working on things in regards to being able to offer grants that will be coming up soon to the community for nonprofits that will be able to provide some assistance in that area to be able to move forward for those services. And I know the city in the past has also been very due diligent about providing grants as well. So we appreciate that. And City Councilman Thompson in the back, I do believe I've seen your hand for some input. We appreciate your input.
Thank you, Madam Chair. I just have a comment and probably a question for Dr. Connolly. I don't want to be off base or not. I'm going to talk about something that wasn't even mentioned today. And that's early childhood development. I think the sooner that we get these kids, we can break the chain. We can break the cycle of where they were to where they're going. Being on the state building code, we have increased the number of kids that can be in facilities due to the parameters, certain parameters that they have. Because daycare is short, not just across the city, not just across the state, but across the nation. So if we can catch these kids early, then maybe we'll preclude us from having some of these problems that we have now with behavior and mental health. So what type of programs or funding that we have that can help a lot of these facilities and properties, individuals and homes, to increase the number of daycares that we have in the city of Fayetteville?
Councilman, here in Cumberland County, we have the Partnership for Children. And that partnership, the county, the city, and the school system are on that partnership. And we collaborate together to manage the slots here in Cumberland County, and the funding that comes from the state comes through Partnership for Children, and it's working quite effective. When you say that?
Yeah, you said exactly what I was going to say. This oftentimes those get facilitated through Partnership for Children. DSS provides some funding for youth and have a collaborative effort, so it's sort of seamless on the side of the resident to apply for those slots. And then on the health department side, we have what we call child care health consultants. So it's important that there's a slot for those kids, but also that it is high quality child care and it's healthy and safe. So our child care health consultants will also go out to the facilities and help to make sure in a non-punitive way. These are different than our inspection staff, but we'll provide technical assistance to those providers to make sure that they're providing that a healthy and safe environment for those kids to be in. So it's definitely a partnership between the school system, the city, and the county to make sure that there's expanding. I will say, of course, I think it's not a secret that we need more child care facilities. And so the partner, I don't want to speak on their behalf, but the partnership, I think, is also doing some work in the community to get more providers trained and ready and equipped to provide child care. I do not know about the funding for that. I can do a little bit of follow-up for that. I'm going to probably speak on behalf of the partnership and say they probably would always take more money if it was possible for them. But they are doing some expansion of training some new health child care providers. So I'll follow up with them about that.
Yeah, I will say that we do need more funding here in Cumberland County for pre-K. And also, even though our mission is K-12, our district does provide pre-K slots out of the local budget. So the state and federal does not fund our board for our pre-K slots. Our county commissioners fund our pre-K programs in our school system, and that all comes out of local funding. So we appreciate the support from our county commissioners for our pre-K slots within the school system. And we do get some funding from the partnership as well. But long term and strategically, we probably need to think about building or repurposing a site to have a pre-K site. All our slots are within other schools. But as a county, we may want to think about, do we just build a pre-K center? And that takes total collaboration.
Thank you, Dr. Conlon.
Thank you for your input. We're going to have a hard stop at 1:20. We started 20 minutes late. We like to be mindful of people's time, so we'll definitely be finishing up at 1:20. I also want to take this opportunity to, speaking of child care development, we do have a child care center for our employees, and we're hoping to have talks with the mayor and the mayor pro tem about possibility having those services to be provided as well for child care for the employees at the city. And that's something, positive. We know that can be a big hindrance. The center is open for all the county employees, and we are hoping that's something we can expand, as we know that that's a hindrance for some families. You have single parents and child care, the cost in itself, but not only that, but just being able to go to work and having a place for them. So we're hoping that perhaps we can, later down the line, have that open for not just county, but city employees, which will allow the opportunity to have more centers, because in order to come to work, you have to make sure that your children have some place to stay.
And think about, Madam Chairman, Vice Chairwoman, think about funding that for teachers as well. Yes, and also, indeed, as we look strategically, the county and city are partnering to get funds for teacher housing. Some counties have gotten that, even from the credit union. But the city and the county have to apply. We can't apply, but those opportunities are out there.
For this, oh, okay, so for housing for the teachers?
Right.
Okay, thank you so much. I'll make sure she's writing that on the board. That's something for us to definitely look in, and that's what these meetings are about. We want to come up with collaborative ideas and suggestions on how can we take care of the individuals that are working in our community, as well as that's an excellent idea. City Councilwoman?
I was gonna say, I would love for that conversation to be had, because I brought
Definitely.
this back in 2019 to council to try to see if we can provide childcare service. So I love for us to
Definitely.
collaborate with that, because it's definitely a need.
2025, great things are coming.
All right.
Commissioner Patel, sorry.
I'm sorry.
Commissioner Patel, you have any input?
Yeah, no, so thank you all for being here in attendance. Really appreciate everyone taking the time out of your day. I know we're running a little bit close to time. I do think, kind of just shifting gears a little bit, it is gonna be crucial for us if we're gonna work together from a county standpoint, a school system standpoint, with the city of Fayetteville and all the other municipalities. We do need to look, hopefully after our strategic planning, like Chairman said, where we align, where we can work together, the advantages are there. Because, working professionally both in the private sector or in government now, we're probably one time in history where we've got multiple generations working together. So the economic opportunities that folks are looking for differ from generation to generation. The viability there from academic opportunities need to be looked at with the school system, how the county could support that, especially with pre-K, coming into consideration. So I welcome working with everyone.
Thank you so much. I'm going to put our shameless plug in here. The strategic planning, which is open for the public to come see for the county, 2 days. It's going to be at the Coliseum in our ballroom, and it's going to be on the 30th and 31st on January 30th and 31st from 10 o'clock until 5 p.m. It will be a 2 full days work for county employees. And again, it is open to the public because we have a lot of work to do. That's why we're taking 2 complete days for our strategic planning. We're looking forward to it to manifest and to move forward. I know we have invited the school board members and some other lead liaisons, but just know that those in the city, you're welcome to stop in or come by if you have available time.
Did have one point before.
Yes, please.
And I know we're coming up on our hard stop, but I love the idea about the child care, and I think Councilwoman is going to make that a motion to take back to our boards. I just want to make sure that we are playing out the larger we make that, what's the impact on a very vulnerable private sector? That the margins are thin, daycares are closing up, so is there maybe a voucher program, or you envision seeing it being city or county run, or some extra incentive just to make sure we don't put business people out of business by a goodwill? So that can be a discussion for a later day. Just want to maybe provide them some extra resources or some kind of incentive to capture local government and in educational employees and their families.
Chairman.
Just to the child care point, we, just across the community, it's that same, I'll keep using that word, ecosystem. We know we've got a cliff with child care that the federal and state dollars are getting ready to dry up in March. That's going to have a direct impact on the private providers in our community that we're going to have to look at. The county system right now is really a market rate system, because the thing you have to look at if you're providing to your employees is then it's a benefit, and there's cost implications with that. Talked to the hospital system is bringing online a 700-person facility. You've got other opportunities out there in the community, but we've got to ensure that we do drive the private sector side. And I know Assistant County Manager Phillips has been looking at and our manager has been looking at kind of what we're doing internally as well, and then how we can make those connections, but on a bigger scale to step back, not just our employees, which are important, but the community child care piece is something that I'm hoping it's going to be a touch point out of our strategic planning, because we're going to face a cliff in this community, and it's going to impact the employees across the private sector businesses. We're going to hear from Robert Van Gien's our economic developer. We're going to hear from our chambers. We're going to hear that. So it's definitely something we're going to have to collectively address.
Mayor Pro Tem Kathy Jensen.
Thank you, Chairwoman. Before I give the information about our strategic planning, I want to go back to 2019, where we had a coalition of elected women officials that got together and we met once a month. And we had Robert Van Giens come out and we said, as a collective body, what can we do to help move things here in our region? And what Robert Van Giens said was childcare. Childcare was killing us economic development-wise, public safety, and quality of life. So the women got together, and you might want to put, Diane Wheatley was there with us at that time, and then COVID hit. And before COVID hit, before we had the ARP money and all that going on, we were still having a hard time getting child care providers, and now it's, like you said in March, it's going to be twice as hard. So I commend you and thank you for doing that. And if we have been talking about getting that coalition back together, so if there's any of us seasoned people that were at that those meetings that can help, we'd be more than happy to help. I hope I'm okay speaking for you. So again, thank you, Chairman Jones. You've done a great job. The city will have their strategic planning on February 11th and 12th, and we will be at the Dorothy Gilmore Therapeutic Center. If you have not seen the renovation of that, and I do have to give a shout out to Chairman Debier. When he was at the Senate, he brought us quite a bit of money back for that reconstruction. But for those out in the audience that have not seen it, it is a great asset for our special needs children. Thank you.
Thank you so much. And again, please be sure, and I'll give the opportunity to the school board, Dr. Conley. Not sure when they have their strategic planning coming up, if they've already had it. But again, please come out and join us on January 30th and January 31st. The ballroom, the Crown Coliseum, 10 until 5 o'clock, we will be having our strategic planning. And Mr. Conley, if you would like to enlighten, I don't know if you all have already had your strategic planning or when it's coming up, if you would please allow us to know that information.
Ms. November, our strategic plan is in place now to 2026, and we review the metrics every year. We can forward that to you in terms of where we are now. And the 4 overarching priorities are successful students, premier professionals, that is at hiring teachers, exceptional environment, and committed community. But we'll send that back to you.
We appreciate that. We look forward to your representative coming to be a part of our strategic plan. Councilwoman Courtney Banks?
Yes, ma'am. I want to motion that we bring this back to the table for further discussion to see how we can work collectively as it relates to child care.
I'll second that.
All those in favor? Any new business before we close? Any new business?
Well, I don't know if I want to say new business, but just here, future, maybe it could be the next one, or maybe that can be a conversation we can have as far as bringing manna to one of our future meetings. I know I'm on the homeless committee, and they did a presentation with some very great information, and I wanted this board to be able to hear, because again, we have school board, the city, the county, and I can give you some great information and hear from them and see how we can work with them to be able to assist them.
I'm definitely in agreement. That is one of the things that definitely, internal in our committee, just as we have individuals that are working for the county and the city that will be guest speakers, we want to also incorporate, no doubt, those that work on nonprofits and individuals outside the city as well. So again, we thank you so much. And Chairman Debier?
I understand, I work for the government of Fayetteville and the city government, but as a person that's in this community every day and see what goes on, and I'm a mother, so I'm with my children, and I understand, I'm a person, I have mental health issues. My children have mental health issues. I have a 3-year-old with PTSD, so it's like, y'all don't, I feel like in a way, y'all have to be out in the community to really know what's going on. The daycare situation, school
Ma'am,
situation.
if you could, on that thought, please. Hold that thought, please. I understand that, but we have to be of decency and order and protocol. If you would give us the opportunity, I promise you, to complete our meeting, some of us will still definitely be here. And
I feel like y'all should all know as a group, because as the community don't come together, because I feel like they're
Ma'am,
afraid. But
if we
me, I'm
do,
a step.
can we do this in decency and order when we finish our meeting? I promise you, we will be here, those at this table to hear what
Because
you
I
have
want
to
to
say.
change this, okay?
Thank you so much. Chairman Deviere?
Madam Chairwoman, just I'd make a motion that we go ahead and table item 5 and 6 for future meetings, so we're staying in accordance with the agenda. So I'd make a motion we table those.
All those in favor? At this time, as there's no other items of business, I ask for a motion for this meeting.
So moved, ma'am.
All those in favor? Meeting now adjourned.